188,000 people in the state of Georgia have Alzheimer's, according to the Alzheimer's Association. SGMC Health has a new treatment that can slow the progression of that disease.
Our Brea Ruffin tells us how it works and who can receive it.
Right now, only patients in the early to mid stages of Alzheimer's qualify for the treatments. The nurse I spoke with says that forgetting names or even simple tasks could point to early signs of Alzheimer's. Leqembi and Kisunla are the two types of treatment. The medicine have been around for about 3 years at other hospitals and research centers, but this is the first time SGMC is offering them to their patients. Nurse practitioner Shelby McNeil says in most cases a healthy brain clears plaque, but with Alzheimer's, plaque gets stuck, leading to the cognitive disorder. She says this medication helps to reduce it. It is administered through an IV for about an hour every 2 weeks, and Leqembi can eventually be taken at home. McNeil says while this is not a cure, researchers and medical professionals are hopeful that it will lead to other discoveries.
If we can keep patients themselves longer, that's the goal. Keep their independence, keep them doing the things they enjoy. The medicines that have been out until now were symptomatic treatment. So that's what's very hopeful to me about this infusion is it actually targets what's causing the Alzheimer's.
McNeil says they have comprehensive testing to monitor how this disease progresses. She says to check with your local healthcare provider to learn about the two treatments and see if you or someone you know could qualify. For now, reporting at SGMC Health, Brea Ruffin, WCTV Eyewitness News.